Internal Revenue Service IRS Tax News. IRS outlines changes to healthcare spending available under CARES Act. IR 2020-122, June 17, 2020, Washington. The Internal Revenue Service has advised that new rules under the CARES Act provide flexibility for healthcare spending that may be helpful to the current environment where more people may need at-home services due to measures to fight the coronavirus. Telehealth and high-deductible health plans. Under the CARES Act, a high-deductible health plan, HDHP, temporarily can cover telehealth and other remote care services without a deductible, or with a deductible below the minimum annual deductible otherwise required by law. Telehealth and other remote care services also are temporarily included as categories of coverage that are disregarded for the purpose of determining whether an individual who has other health plan coverage in addition to an HDHP is an eligible individual who may make tax-favored contributions to his or her HSA. Thus, an otherwise eligible individual with coverage under HDHP may still contribute to an HSA despite receiving coverage from telehealth and other remote care services before satisfying the HDHP deductible, or despite receiving coverage for these services outside the HDHP. The temporary rules under the CARES Act, as extended by IRS Notice 2020-29, there's a link to that here. It's a PDF file. There'll be a link to this in the description. Apply to services provided on or after January 1st, 2020, with respect to plan years beginning on or before December 31st, 2021. Expansion of qualified Medi-Cal expenses. The CARES Act also modifies the rules that apply to various tax-advantaged accounts, HSAs, ACRE MSAs, Health FSAs, and HRAs, so that additional items are, quote, qualified medical expenses. So they're typically a good thing if we can have the qualified medical expenses under these laws, and therefore they're basically expanding the qualified medical expenses. Back to the text. That may be reimbursed from those accounts. Specifically, those costs of menstrual care products is now reimbursable. These products are defined as tampons, pads, liners, cups, sponges, or other similar products. In addition, over-the-counter products and medications are now reimbursable without a prescription. The new rules apply to amounts paid after December 31st, 2019. Taxpayers should save receipts of their purchases for their records, and so that they are able to submit claims for reimbursement. More information, the IRS will provide any further updates as soon as they are available on its website at irs.gov/coronavirus. There's a link to that here. There'll be a link to this in the description.